Hi, I'm Sarah Herron, occupational therapist specializing in stroke rehabilitation. There are many aspects to consider following stroke, but today I want to talk about one specific portion of visual assessment that is often overlooked. If we think about our visual system, I think anyone can attest that we use our vision constantly throughout our day. We use it to find what we're looking for, read books and road signs, judge distances, make predictions about our environment, and keep ourselves safe. We use it for just about everything. And research supports what we already know. Vision significantly impacts our function and quality of life. Now let's try something. Hold your fingers up in front of the left portion of both eyes. Now look down at that paper in front of you. Try reading it. Or place the fingers on the corners of both your eyes and gently push in and out on your eyelids. Now try reading that paper again. Or imagine trying to go up and down stairs, or even put toothpaste on your toothbrush. Not so easy, is it? Unfortunately, these symptoms are similar to many that stroke survivors endure every day. Research estimates that on the low end, over 230,000 stroke survivors annually are negatively impacted by visual deficits. As occupational therapists, we are primarily concerned with function, and this is often where we first see signs of visual deficits. Once we determine that vision is negatively impacting function, it is important to do an accurate and specific assessment. Vision functions as a hierarchy. If those foundational visual skills are not intact, the higher level visual processing skills will also be negatively impacted. Today, I want to talk about assessing 3 of those foundational ocular motor skills. They are visual pursuits, saccades, and accommodation. To assess visual pursuits, sit directly across from the person and hold up your finger about 12 to 15 inches from their face to provide the target. Move your finger up, down, side to side, and diagonally in all directions. Ask the person to follow your finger with their eyes. Ideally, you'd like the person to keep their head still, but often I don't cue them to do this at first. I want to see what their initial response is. If they turn their head to follow the target, it could indicate difficulty isolating head and eye movements. If this happens, just ask the person to do it again, this time keeping their head still. You may also want to give the target more than once in each direction to see how the eyes perform as they fatigue. Observe the eye movements. Are they able to track the target in each direction? Is one direction more difficult to go than another? Are they able to maintain visual fixation throughout? How is the speed of the movement? How is the smoothness of the movement? To assess saccades, sit directly across from the individual and hold up 2 targets this time, still about 12 to 15 inches from the face, about eye level, and about shoulder width apart. It may be helpful to use 2 different targets, such as your pen and your finger, or 2 different color objects to make it a little bit easier. You're going to instruct the individual to look back and forth between your 2 targets on your command. You want the person to complete 5 total revolutions, 10 visual fixations in all. Got my pen, finger, pen, finger, pen, finger, pen, finger, pen. Observe how their eyes move. Are they able to find the target in each visual field? Is one direction easier to go than another? Do their eyes go directly to the target, or do you notice a slight overshooting or undershooting as they're trying to fixate? Think about the smoothness of the movement. Think about the speed of the movement. When you assess accommodation, you're looking at the person's ability to bring their eyes together to focus on a target that's close to them, and then bring their eyes slightly apart to keep it in focus as it moves away. To assess accommodation, sit directly across from the person. Again, you're going to hold up your finger, and you're going to ask the person to keep both eyes on the target as you bring your finger closer to their nose. You may want to demonstrate this one so that they know what the eye movement looks like. Then slowly bring your finger away from the person's face. Watch to see how their eyes move. When you bring the target closer to them, do both eyes converge to keep focus on the target, or do they lose fixation altogether, or does one eye break away before the other? As you bring the target away from their face, look to see if both eyes come out equally to maintain the focus on the target as it goes away from the person. Some deficits in oculomotor skills will be obvious, others will be more subtle. The best way to become proficient at assessing these skills is to look at the way a lot of healthy individuals' eyes move. That will make identifying abnormal movement easier. If any of these foundational skills are negatively impacted, higher level visual processing will be as well. With specific assessment, you can better direct your plan of care to positively impact the individual's function and quality of life.